Thank you all for being here this afternoon for this very, very important piece of information. So just thank you all, and this is our first time to actually meet and interact all in person. So I really, really appreciate it. We're now into our 4th week of school, and not only navigating our virtual instruction, and all of that has to do with teachers and our students and their awesome work, but we've also had the threat of tropical storms and hurricanes. So we have been very, very busy in preparing for our students. I'd like to first start off by saying just that all of us send our love, excuse me, thoughts and prayers to all of the families in southern Louisiana and that have been impacted by Hurricane Laura. It has been a tremendous impact on those communities, those families, and we certainly reach out tremendously to those families facing these challenges as well as the additional challenges that we need to all support each other during this time. The EBR school system actually welcomes every single student from any of those parishes. We invite them to our schools. We want them to be a part of the EBR school family. We want our parents to come and register right away. Please contact the Child Welfare and Attendance Office at 225-456-5080 in order to enroll. We are ready for all of your children to become a part of our wonderful EBR family. One of the other things that we have started is a donation drive for school supplies here at the central office. So anybody that would like to donate school supplies, please drop them off at the central office, and we will be sure that we get them to the southern Louisiana school districts and families. Speaking of offering a helping hand, at this time I'd like to introduce 2 of our team doctors that have been on our medical advisory committee in helping us make these decisions. First of all, we have Dr. Catherine O'Neill. She is the Chief Medical Officer at Our Lady of the Lake Hospital, and also one of the assistant professors for infectious diseases at LSU. So she has been an absolutely wonderful support structure for us as we've gone through this process. We also have Dr. Michael Bolton here with us. He is our program co-director of pediatric infectious diseases at Our Lady of the Lake Children's Hospital. So we feel that we have had a great team. We have some other members that have been on this committee, but these are 2 of the lead doctors that we have been working with, and we really, really appreciate their precious time. You'll hear from them in just a minute, but I cannot thank them enough for their time. So through this important work, we have been examining the COVID data during a period of 10 to 14 days, trends that have been pointing us in the direction to making this decision. Very important decision. This data, along with our extensive school preparations at each of the school sites, gives us the ability to enter the hybrid learning model for pre-K through 5th grade students, starting with pre-K through 5th grade students, beginning September 14th. We believe that we have a window of time to get our children back in school, have them good and ready, and have the schools absolutely welcoming them back with open arms and just an awesome opportunity to provide services in the classroom, which is where we want our children. Pre-K through 5 students will be able to attend in person 2 days a week. That is our hybrid model. 3 days would be virtual. So a group of students would go Monday and Tuesday. They would have Wednesday as virtual. And then the second group of students would go Thursday and Friday. So throughout the whole week, we will have students in school, except for on Wednesdays, which will be our deep cleaning days, and giving us the opportunity to make sure that everything is ready in our schools for the next session. Okay? So that will allow us to continue to serve all of our children, meeting all of the CDC guidelines, making sure that we meet the social distancing, the lower number of students per class, and providing a very, very safe environment for our children to return to school. So I'm also thrilled with the work that has been taking place with our teachers and students online. We have had some very, very successful opportunities and results from that. We know that there have been some challenges, but we've really been very, very impressed with the teacher work and the opportunity for them to be educated during this very difficult time. Okay? We also believe, like all of you out there, that there is no better place for children to be educated than in the classroom. That is our primary goal. That is where we are headed. So with that being said, I would like to turn the mic over just for a second and share some information from our medical experts and let them give you some of the data that we've been looking at in order to go to this hybrid model on September 14th. Dr. O'Neill?
Thank you so much. Thank you all for being here today. I think it's a very important thing to understand why we feel like it's safe to go back to school and why we feel like it's important that we reach this decision together. Over the last 6 months, we've seen in our community 2 big increases in community cases, followed by a decline in community cases. During that first increase, we saw community cases drop because we stayed at home and because we closed our schools through a stay-at-home order. This time, in our second increase in cases, we saw a significant drop in community cases following the increase, but not through a stay-at-home order, but instead through a universal masking mandate, through closing bars and decreasing social activity. We were successful in getting cases to drop in our community by doing the things that we knew would be helpful, by masking at all times, by social distancing in all social situations at work and in the classroom. We've seen that success play out in our community rates dropping and our hospitalizations dropping. And so as we've looked at this data through July, we've now had a 6-week decline in community cases and a slow but steady decline in hospitalizations. We look forward to our kids going back to school. We all do. We want them to go back to school safely. And our schools have implemented all of the CDC guidance to do that, and now we've seen a decrease in cases. Now is the time to put kids back in the classroom. We're excited about this. We've seen the community go back to school in small amounts over the last month, and we've not seen that increase in cases that we hope not to see. And so we feel comfortable with the data. The data is driving our decisions, and we'll continue to remonitor the data and we look daily, but to look for those 10 and 14-day trends so that we can make sure that our kids stay safe. I'm going to turn it over to Dr. Bolton.
Yeah, thank you again for the opportunity and the opportunity to participate in the Health Advisor Committee for the East Baton Rouge Parish School System. You know, one thing we tell our learners is that kids aren't just little adults, and so we treat them a little differently. And so when it comes to the spread of novel coronavirus during a time of a global pandemic, you know, we didn't really have an opportunity to see what happened with kids in schools because, appropriately so, schools are shut down. I think now, as we learn more about the novel coronavirus, not only in adults, but we're learning more and more in kids, how do we safely open schools while also giving parents the peace of mind that the things that are being done at the schools are safe and provide a nurturing environment and a safe environment for their kids and for the teachers that are teaching our kids. As Dr. O'Neill pointed out, we've seen local experience of schools going back, both elementary and high school students, and we have not seen an outbreak of coronavirus in these institutions, and we're very pleased by that. I think part of that stems from the activities that are going on in those schools. In particular, Dr. O'Neill referenced wearing masks, watching your distance, and washing hands. I think the more we do that, not only in schools, but in the community, that's going to go a long way to keeping our positivity rate down, diminishing the number of cases in the community, and doing our best to keep the schools open. As a parent, it's a little unusual to think about sending your kid back to school during a global pandemic, but I think there's been a lot of deliberation, a lot of consideration, a lot of discussion that's happened to ensure that the steps taken are safe and that are reproducible in the different environments in which our kids attend school. So I think with the data that's driving our decisions and the multiple hours of discussion and deliberation that's taken place, I think the place for our kids to be are in schools as much as possible. And we'll continue to monitor the situation over time and make sure that decisions are made are data-driven, are thoughtful, and in the best interest of children and teachers.
Thank you very much, Dr. O'Neill and Dr. Bolton. So we are really, really thrilled to be able to provide this information for you today. I think we have got a great plan going forward to get our children back into school on September 14th. From there, we will take a look at the data with our committee and make a decision on when middle schools will come back and on when high schools come back. That is, again, depending upon the data, at any time we see where that data allows us to open at the middle school level and the high school level, those will be our next steps. So we're very, very much looking forward to adding the hybrid model to the middle as well as the hybrid model to the high school as the data continues to show. We also know that we also have the phases that are coming out of the state. So as soon as we are able to move into phase 3, that will give us more bus capacity, which is another piece that we're only allowed to put students on buses at 50% right now. So that is another reason why we have been phasing from pre-K to 5, so we can see how that works with our transportation. And then as space becomes available in our transportation area, we will be able to put more students on buses and be able to get them to school. So we are looking at all different variables when it comes to how we open our schools and provide the opportunity for children to return to school. So thank you all very, very much for being here today, and just looking to see if there's any questions or comments that you might like to share with us. Okay?
Just considering, I know we're grateful to be able to accept those displaced students that are coming in from Lake Charles. But with that, accepting them, how does that play into when we talk about capacity and COVID-19 guidelines? Do y'all feel like that may affect any of those guidelines or capacity?
So I really, really appreciate that question. It's a very important question to everyone. I think one of the pieces that we are working on that I think is very important is there is a number of families that will continue to be virtual, and families that are coming in and maybe living with other family members that may feel more comfortable being virtual. So doing the hybrid as well as the opportunity for virtual actually does provide us more space at our schools to be able to accept students from many, many different areas in southern Louisiana. Okay, so thank you.
So you talked about the data that allowed you to get to this decision today, but you also reserve the right to maybe pull back if need be. And you also, it sounds like you have some data that you're assessing as you figure out whether to go to middle and high schools. Talk about that. Like, what are the kind of key indicators that will drive whether to go back or whether to continue in the secondary grades?
Thanks, Charles. That's a great question. I think that most of us are very familiar with the LGH website. We also utilize the case data that we get through the mayor's office, so parish specific and then region specific, knowing that our entire region is very affected by any sort of activity that may be occurring, whether it's in parish or within the region. So we're looking mostly at case counts, so daily case counts. We're also going to always monitor hospitalizations because that's a big trigger, but they lag behind case counts. So when we talked about those 2 peaks that we've already seen in cases, we saw community rates go up before we saw hospitalizations go up. And so we'll be looking for that same trend. Is our community rate stable? If we start to see an increase, what is that rate of increase that makes us say, hey, I think we're going backwards and we may need a step back? The good thing about this committee is that we have a lot of input from a lot of different sources. We're able to all see with very good transparency the mayor's data and the Region 2 data to make those decisions.
A lot of testing that wasn't able to happen because of the storms. That, you know, we talked about flying blind this past week. Does that mean that you're going to be looking at this extra hard the next few days? Is there any kind of flux there?
I feel like we look at it extra hard every day, and we have gone through some. We've gone through some holidays. So since March, this has been a really long journey for us, even though we're still in 2020. But since March, we have had days where there was no testing. We've had our tent shut down for multiple days because of rain events. We've had our tent shut down because of holidays. So we've had these big gaps where we come back and we see data and we analyze it. And that's why you look over a 14-day trend. You don't take anything day to day. I look day to day, but I trend it over 14 days because really that's the only thing that can give you a great picture. We'll see if we have an increase when we come back. We're looking at a couple different things. We're looking at the events that led to decreased testing. We're looking at what the movement of a storm does to the spread of COVID within the state. Luckily, and we saw this play out in the news a little bit this week, when you move people from a high incidence area to a low incidence area, you may actually benefit those people. And what we're seeing is a lot of people from Southwest Louisiana being relocated to our lowest incidence area, which is Region 1. So hopefully I think that's a great decision by the state. Hopefully that plays out to be the safest decision, but only time will tell.
We've seen the increases after Memorial Day. We've seen the increases after the 4th of July. Any concern there with this?
Yeah, I'll take this one. Save Dr. Nielsen voice. So we're going to be looking at that. We don't know how that's going to play out, seeing as how we're still in phase 2 from a state standpoint. We're going to see those numbers both from community spread. We'll also look, some schools are in session right now. The Catholic Diocese is in session. So we're going to be looking at that and see over the next 2 weeks after Labor Day what our case positivity rate looks like, the number of cases on a daily basis looks like, what our hospital capacity looks like. So again, this is a dynamic situation. So we don't just say schools are going to open in hybrid now and just full forward. We're going to kind of be very considerate with the data that we have available for us and help make that determination along with the school board.
Outbreaks at the schools. The state tracks what it's calling outbreaks, and it has seen a few at schools, but are you, explain that to me, what you mean by that?
Yeah, no, that's a great question. So from a standpoint of having severe outbreaks that lead to spread within a school setting, Our Lady of the Lake works in particular conjunction with one school in the community where we provided guidance, we provided testing, and when we look at that, we're not seeing outbreaks in that school. And so while we see cases, it doesn't portend that the cases spread in the school. They're community spread, which is what we're seeing around the area. And so as we get the community spread under better control, I think that allows us a better opportunity to send kids to school more safely. And so yes, there are going to be kids who test positive and they're in our schools. And so the idea is to isolate them and make sure that we follow the proper policies and procedures to make sure that we keep them isolated to minimize the risk of spread of COVID-19 in the school setting.
So that's largely based on your experience working with that one school, which you've been observing there?
That one, yes, sir. And then also reports from the Catholic Diocese around the area where we haven't seen tremendous outbreaks in those areas, and they've been going to school now for 2-3 weeks, I believe. Yeah.
I have a question for you, Superintendent. And is there a plan for, because we have seen it, some of the other school systems that did, have all their students back in the classroom, but there were a lot of cases in one particular nearby parish. What's the plan if that were to happen in EBR at maybe 1 or 2 particular schools?
Sure. Thank you very much for that question as well, because I think that's an important question for parents as well as schools. So once a positive case has been identified, that particular case is actually reported to the school, to the principal, and as well as to our office. A report will be filed immediately with the close contacts. So we actually, if it's a classroom and there's a child, those close contacts are sent a letter immediately letting them know that there was a case in the school. So those particular students, there will be a protocol for those students to actually be able to know and understand doing the self-isolation, where they would spend time at home and then come back to school after that self-isolation is completed. In most cases, we would only look at an individual site, like we have, for some of our adult cases that we have already done. And once that self-isolation period is done, then everybody, this classroom is completely cleaned, and it is all sanitized, and they are able to really provide a very, very safe environment for the teachers and the students to return to. Okay? So that's how we're dealing with those individual cases. When we see that there may be, contact tracing that goes a little bit wider, we would absolutely widen that communication system, for those groups that we would need to do that letter immediately to. And then there may be, down the road sometime where there might be a larger impact that we might have to consider, closing a school for a day or two while the whole school is cleaned, and getting the students back to that school as soon as possible. So there are definite steps that we take to make sure that each of those cases are looked at individually, I think there is some nuances in each of those cases that we would look at, but basically those are the steps that when it's identified, it's reported. There's contact tracing absolutely done right away, notification, as well as determining what self-isolation timeframe there might be, and also taking a look at how many students have been exposed. So, okay? So a very, very clean, tight process for that, okay? So a couple of things that we have worked really, really hard with on HR is we actually have had some really awesome work done with teleworking. Teleworking will end on September 10th, and so the teachers will be asked to come back to school. There may be cases where there still is some opportunities or challenges with COVID or medically identified concerns with teachers coming back to the classroom. So those cases will be handled by HR, and so we will be able to take a look and help support those teachers during that time and figure out the best way to continue either through virtual education for those teachers, or they may need to take a COVID leave to be able to continue within the system, okay? Today we announced the return of pre-K through 5th grade being able to return to school in the hybrid model on September 14th. So we're very excited about that. We want our children back, so we're starting with a phased approach where pre-K through 5 comes back first, and then we will take a look at the middle school and the high school from there.
Tell us about a little bit of the work that got you to the point of moving forward with this model.
Yes, we've done a significant amount of work with our Health Advisory Committee. They have been essential in helping us understand the data. There's so many different pieces of data out there. We really looked at narrowing it down to the actual increase of cases, increase of new cases in East Baton Rouge Parish. We used the data from the Louisiana Department of Health and narrowed it down to East Baton Rouge Parish. And what we have seen is a decrease in the cases from August 1st to August 14th, and then another decrease in cases from August 14th to August 28th. So we believe that we are ready to safely allow students to come back to school in the hybrid model.
What is your message for parents right now that might be a little concerned?
My message is that we have seen just some great opportunities for children to be in schools, to get back to that social emotional environment of being with their peers, and the safety protocols that we have put into every single school. We have increased all of our cleaning, all of the protocols, in making sure that our schools are sanitized and safe. And we have been working very, very closely training all of the staff to make sure that all of those protocols are being followed specifically for not only our students, but also our teachers to be safe and comfortable in the school setting.
A key question will be if a student or a teacher tests positive, what is the plan at that point?
So we have very specific protocol on the plans for when a teacher or a student tests positive. We actually report that right away. It goes to the district as well as to the health department. And we also make sure that there is a contact tracing that happens right away. We actually look at every single area that a student or a teacher might have been in. We send letters immediately to the contacts that have been identified through that process. And we also allow the information to tell us what areas of the school need to be shut down, sanitized. Students have an opportunity to self-isolate at home during that time frame. They can come back as soon as the classrooms have been cleaned and sanitized to get back to school as soon as possible.
What about testing? Will testing be available? And what is your recommendation for parents in this area?
So we believe that the ability for students and parents to get tested is a decision that they make. We are not going to do specific testing at each of the schools. However, we are working with one of our partners to do mobile testing, where they would go around and have a testing site set up at different periods during the school year at different school sites. So that is an opportunity that we're working on right now.
You've had students in virtual classrooms since March. What kind of results have you seen, and the advantages that that offers for the students and for the parents?
Yes, what we have seen in the virtual environment is students having the opportunity to engage and actually show their work in many different ways. So students are able to turn their work in online, as well as to participate face-to-face during the class time, as well as making sure that we meet the state required minutes of instructional time for each of the classrooms. So the teachers have been working very hard with the students, as well as with the parents. The parents actually have a Google phone number where they can contact their teachers, and we've seen, oh gosh, just some great communication between teachers and parents that we were unable to do before. So some great stuff going on.
Beyond the COVID situation, this is your first year as superintendent in East Baton Rouge Parish. What would you like the public to know about your goals for this school system?
So my immediate goal, of course, is to get every single student back to school 100% face-to-face. That is what we are headed for. The next goal is to really take a look at the academic rigor and the ability for children to be able to access highly rigorous courses, increasing our student assessment scores, as well as our graduation rates. So those are some of the big pieces that we are working on right now. We have done some really tremendous work on looking at the data, finding out where we have some challenges, and then we will be moving that forward through the strategic planning process.
What role does community support and business support play in the public education system in EBR?
So the community support as well as the business support is essential. I have been able to get out to work with some of our community organizations as well as our business organizations, and we are looking forward to them participating in our strategic planning process as we go forward. That process is not an overnight process, but we certainly will be looking for input on that strategic plan and how the school district can actually help build those relationships with community members and business partners as we design the new path for East Baton Rouge Parish Schools going forward in the strategic plan.
How can people get more information?
They can actually take a look at our website and keep an eye out for when we're beginning those strategic planning meetings. We don't have them set right yet. We're starting our planning this next week. And so I look forward to posting something on the website for how family members, community members, and businesses can participate in that strategic planning process.